I'm Dr. Mark Jagger, creator of the Spine Specialist and Spine Specialist Clinics. I'm doing a series of videos here on the frequently asked questions we get, and one of the ones we get all the time is, what is the story of the Spine Specialist? How did this incredible device come into being in the first place? Well, the best way I can start that story is to start out with a phrase that everyone knows. Necessity is the mother of invention. So necessity is the mother of invention. That's really how the spine specialist came to be. So many of you that are suffering in pain and have found no solutions for their back pain, neck pain, and various ailments that are related know that there are a lot of different options out there, and there are a lot of different things that work. There are a lot of different things that don't work, and everybody's a little bit different. Well, I was in that exact same situation in about 2007. I have a sports history of hockey since I was, well, probably since before I could walk. And then I took up weightlifting when I stopped hockey. And I have a disease that is called Sherman's disease. Now, not necessarily disease, it's basically like degenerative arthritis throughout my spine, about 50 years ahead of what it should be. So, for some of you that are familiar with the condition of ankylosing spondylitis, it's essentially like that condition. So we've lost disc space. In a lot of cases, I don't have disc space. There are a lot of nerve compression, a lot of tightness, a lot of stiffness, and loss of range of motion in my spine. The only difference with me and an ankylosing spondylitis patient is I don't suffer with as much inflammation. So the stiffness is always there, but the inflammation goes through stages. So with my sport history, with my work history, adjusting patients at a high volume for a few years at that point in 2007, I ended up with a neck condition that I could not get rid of. I had chiropractic. I'm a chiropractor. It's the first thing I'd go to. Didn't work for me. I had acupuncture. I had massage. I went through physio. I went through everything you can think of. And I was thinking of having an MRI on my neck to see if surgery was the next phase for me. But I really didn't feel like it was. I really didn't want to go through that. Neck surgeries can be quite dangerous. I could wake up not being able to move, and I didn't want to chance that, being young in my career and wanting to start a family and all this type of thing. So necessity was the mother of invention. I thought for my neck, it was very compressed and very stiff, very tight. It just felt like everything was weighing down on it. Chronic headaches, 3 days a week of migraines, to the point where a lot of the time I couldn't stand up. I was dizzy, I was nauseous. When I had to adjust patients, they would come to the dark room that I was laying in and wake me up and get me to adjust patients, go back to that room and lay down again. It got that bad. I felt like I wasn't going to be able to work, wouldn't be able to pay my student loans off, my business loans. I didn't know what to do anymore. So I thought, hey, you know what? There's this thing called spinal decompression. It sounds like it might be a good option for me. I'm going to try it out. So I did try it out, and it did help a little bit. So I thought, hey, you know what? I got a lot of other disc patients that are in similar situations to me. I'm going to get a decompression table. I'm going to start using it on them. And I thought, well, geez, you know what? There's also the issue with soft tissue. So we have nerve damage, we have muscle damage, inflammation. Laser therapy does a phenomenal job at getting rid of those things. So I thought, hey, why don't we combine the soft tissue injury healing capability of laser and the stretching and decompressing ability of a decompression table, put that in a program, and see if that works better than what we used in the past. And miraculously, it did. Thankfully for me, it did. So a few years down the road, we're using that a lot with patients. It got rid of my neck pain. It helped a lot of other patients. There were still difficult disc patients that weren't quite getting better with decompression and laser separately. They did okay, but I felt there was still some tweaking we could do. So what I did was I actually felt that using the laser at the same time as the decompression might give us slightly better results. There was no device on the market in the world that actually did that. So what I did was I took my knowledge of some electronics and robotics and that type of thing. I knew it could be put together, so I contracted some people to help me put that together. And we essentially installed a robotic laser underneath the decompression table so we could do decompression and laser to relax the muscles and stretch everything out all at the same time. And that's where the spine specialist was born. We've been using it in our office since about 2013. There's a number of other doctors that use it as well in their clinics right across Canada. And we're actually porting it out all across the world actually this year. So we're very, very excited for what this treatment can do for patients, for what this treatment can do for the world in general, those suffering in back pain. It is a better solution than anything that we've had access to in the past. It fixed me, it has fixed thousands of patients that we've had. So we're really looking forward to seeing if it can help you as well. As far as where it's built, right here in Mississauga, Ontario. So parts are ordered from all over the world, various different components and things like that that we put together. But the design, the development, the thought process that took place to get this device to doctors and patients where it is needed took place right here in Mississauga. So we're the home base. So if you have any questions, please feel free to email, give us a call. We would love to hear from you. We would love to help you get out of pain if that's what you're suffering with. That's what it was built for. And that is why we do what we do. Thank you very much for watching, and I look forward to meeting you. Take care.